This is not herpes. It's not a bacterial infection, and it's not psoriasis. So what is it? This is a common type of hand eczema called dyshidrotic eczema. Hey guys, I'm Dr. Laura Song, board-certified dermatologist. Welcome to my channel where I talk about all things related to skin and dermatology. If you're new here, make sure you hit that notification bell so you don't miss any of my future videos, and subscribe to my channel. So what is dyshidrotic eczema? It's actually a pretty common type of hand dermatitis that affects many different people in the world. It usually presents really quickly as these small little itchy blisters on the sides of the fingers and sometimes on the palms. Rarely, it can also affect the soles. Flares can be triggered randomly through the year, every few weeks for some people, and sometimes every few months. It usually starts off as this sudden onset itchiness on your hands, and then you get this explosion of small itchy blisters, usually on the sides of the fingers and on the palm. Rarely, it can also affect the soles of the feet. Without treatment, the flares usually last several weeks before it goes away on its own. Most people find these types of rashes on their hands to be really itchy, and it can definitely impact their day-to-day activities. So what brings on these eczema flares for people? So common things would be exposure to irritants, that might be harsh soaps or if you're washing your hands too often, allergens on the skin, particularly metals, so that might be nickel or cobalt, for example. Some people notice it flares with stress if they're going through some difficult times in their life or having some emotional turmoil. Some people notice sun exposure, smoking, or even excessive sweating can all trigger this type of rash. Diagnosis of dyshidrotic eczema is usually pretty straightforward for a dermatologist. We just ask about your classic triggers, how fast it comes on. We look at the characteristic appearance of the rash, so these teeny tiny, almost like tapioca pudding, little vesicles or blisters on the sides of your fingers or on the palms, and it typically goes away within a few weeks without treatment. So here's 5 things that you can try at home to reduce the frequency or likelihood of flares of your dyshidrotic eczema. The first is just gentle hand care. So make sure you wash your hands in lukewarm water, not boiling or scalding hot water. Use a gentle non-soap cleanser, so something like Cetaphil or CeraVe hydrating cleanser. Make sure you moisturize every time you wash your hands to keep that skin barrier nice and intact. The second thing you can do is try to quit smoking if you do smoke. We do think that smoking can flare this type of eczema. The third thing you can do is try to manage your stress. So if you're not handling your stress well, make sure you seek help for that. And the fourth thing you can do is if you struggle with excessive sweating or hyperhidrosis on your hands, common things over the counter you could try before seeing a dermatologist about excess sweating would be to try a over-the-counter antiperspirant, something with aluminum salts in it, for example, Drysol. The fifth thing that I recommend is anytime you're using anything irritating on your hands or you're doing any type of wet work, for example, cleaning your house or doing dishes, make sure you wear gloves. In terms of things that we can do in the clinic, I often write patients a prescription for a high-potency class 1 topical steroid. So for example, something like clobetasol or halobetazol. And this is usually in a cream or an ointment format that you can put on when your hands are flaring to help expedite resolution of the flare. Well, that's it for this video. Thanks for watching. Make sure you subscribe to my channel for more content like this, and we'll see you in the next one.